In our society, there is lack of awareness about lupus. Lupus means systemic lupus erythematosus. This disease presents with there is redness over nose and cheeks, that is a rash in the form of butterfly, in the shape of butterfly, and that rash aggravates on going in the sun, and there is a burning sensation. So this is the symptom over the skin. But systemic lupus erythematosus, this disease is not limited only to skin and hair, but it is a multisystemic disease. That means it can involve kidneys, joints, heart, lungs. So it has more than one organ involvement. That is the reason why the patient, there is need of increasing awareness among the people about this disease. If anyone has this symptom, presents with rash over the face which aggravates on going in the going in the sun, then, and there is weakness, anemia, hemoglobin is decreasing, then the patient should approach the dermatologist as soon as he comes to know about it, because he or she, because the disease, when it is diagnosed and early treatment is given, then the disease will not progress. So it generally this disease is seen between 15 to 45 age, and 90% of the patients are females. So the females generally present with the rash on the face, and then after the diagnosis, the dermatologist will examine, and after that for diagnosis some blood test may be required. First is the examination, the blood test, and sometimes biopsy may be required, and after that the drugs, means the medicines, will be started. So let's see one by one what are some of the symptoms. Other symptoms, there are recurrent ulcers over our oral cavity, mouth and nose. There is hair loss. Then there is joint pain, sometimes bluish discoloration of our fingers in cold, if we dip it in cold water, and there is pain over these fingers after dipping in the cold water or in the winter season. Then there may be anemia, and there may be breathlessness. There may be sudden pain if we breathe, then there may be pain in the chest. So these are some of the symptoms. There is other disease known as DLE, that is discoid lupus erythematosus. In this disease is limited only to the skin and hair and does not involve organs. So this DLE is safer than SLE. In DLE what happens is the same rash is seen over the face. It may be seen over our scalp also. If it is dark colored individual, when this rash heals, it may heal with white patches, and we can see white black patches over the face as well as over the scalp, and it leaves the scarring alopecia. That means the hair will not grow over that rash present over that area. So this is DLE. In SLE we have joint involvement, so there may be joint pain, and the hemoglobin is decreasing, there is anemia. So the patient, while going outside, he should wear full sleeved clothes. He should avoid sun exposure if possible. He should wear cap, sun goggles, etc. Secondly, he should take his medicines regularly. He should follow up with the doctor regularly, and the doctor, after examining, he can change the medicines. He can on and off, he can start the treatment. In pregnancy, the patient has no means the patient can become pregnant, but during pregnancy some of the drugs may be stopped, and but there is no risk or no contraindication for pregnancy. After pregnancy, the patient should again seek the dermatologist and should continue taking medicines as per the dermatologist's advice. So the patient can lead a normal life after following all these precautions as well as the course of medicine, and the disease will not get aggravated.